The SGLT2 inhibitors are a family of drugs that were initially approved for the use of the treatment of type 2 diabetes. The three most commonly used SGLT2 inhibitors are Invokana, Farxiga, and Jardiance. There are a couple of others. There's Brenzavia and there's Teglatro. They aren't used as much. Over the last several years, the companies that make Farxiga and Jardiance have been having this little race to see who can prove that they can do stuff other than treat type 2 diabetes. So Farxiga got approval a while ago for the treatment of CHF. It has been shown to decrease the risk of hospitalization due to congestive heart failure. And then Jardiance came out with their data that it decreases the risk of a major cardiovascular event in people with known atherosclerotic heart disease. And then Jardiance also came out with data as far as decreasing the risk of CHF. They both have renal data. All right, so they were all doing their separate studies, not comparing themselves to each other. And somehow the makers of Invokana have given up playing the game. Anyway, there's a recent article that compared what they're calling real world data. It's an observational study. So it's not under a controlled environment. They did not try to match patients one to the other. They gathered data that exists already in databases and compared people who are taking Jardiance, Farxiga, and Invokana. And what they found, not surprisingly, because they all work similarly, is that they all decrease the risk similarly of hospitalizations for congestive heart failure and hospitalizations for heart attacks and stroke. Overall, the safety profile seems to be about the same, although they did find, curiously enough, that there was a lower risk of yeast infections in people taking Invokana and Farxiga versus Jardiance, a higher risk of urinary tract infections with Invokana, and a lower risk of diabetic ketoacidosis with Farxiga. But all in all very similar. So, what is the take home here? And again, it's kind of hard to interpret when it's just an observational study. But if your prescription plan requires that you be on one SGLT2 and not another, do not feel that you are somehow losing out because you're not getting the cardiovascular benefits that the others claim that they have, because they all appear to have similar benefits.